I just want to jump to the ears for a minute. And because there's a lot of questions, the first one I saw was, can you speak a little bit about how GPA affects hearing? I've lost a bit of hearing on my left side, but I'm unclear as to the mechanism aside from what you mentioned in the beginning. And there are people who have asked about, I always say it wrong, tinnitus or ringing of the ears. So if you could address some of that, that would be great.
Sure. So the ear really comes in two halves. We call it the middle ear, and outer ear, which is the mechanical portion, and the inner ear, which is the nerve portion. Hearing loss can come from mechanical obstruction or from nerve disease, or sometimes both. The most common hearing loss is the hearing loss of aging. It's called presbyacusis. And that's as we get older, the hearing nerves sort of wear down a little bit, like a lot of things in our body. Let's go back to the very first slide. When I think of, again, this is a disease of respiratory tissue. And I said the middle ear and the mastoid is respiratory tissue. So just like you can have a fire in your nose, you can have a fire in your ear, or even a small one. It's a very small cavity that makes fluid, and that little fluid's got to go out of the ear through something called the Eustachian tube into the back of your nose. The nose could be blocked in GPA. The middle ear could be blocked. So if it doesn't drain, what's going to happen? Well, I can tell you, it's not a question of if, but a question of when is A going to get infected. And B, when the middle ear does not drain, you get a backup of fluid. And the most common operation in the United States today, I think, is still putting tubes in the ears of children when they have fluid in the ear. In order to drain that fluid, you short circuit the system by putting a hole in the eardrum, a little grommet, you suck out the fluid. Any fluid that comes on, that comes out the ear canal instead of the middle ear, down to the Eustachian tube. And the great thing about this, I mean, it's instantaneous. I mean, the hearing is better by 99%. They have a 10,000-fold improvement in their hearing almost instantaneously. If it's mechanical, you often have to keep that tube in for a while. Children, they have to be put to sleep for that, but adults will do in the office. It's a 10-minute procedure. It's actually very gratifying when someone says, I can't hear, and then they're clogged and then they can hear. So that's one part of it. Now, GPA Wegener's can cause what's called a nerve-based hearing loss, because the back of the ear, when you go towards what's called the promontory, where you have something called the oval window, the round window, that's the area where you get into the nerve side of the hearing. And that part of the ear is a little different. It can be subject to toxins that go through this window. It can cause inflammation of the nerve. And if you have a nerve-based hearing loss in GPA, I consider that actually very serious. I work very closely with a doctor in Manhattan. His name is Robert Spira, who's just terrific. And I think he gets it, because a lot of rheumatologists, someone has foot drop, if a peripheral nerve will be affected by the vasculitis, by the GPA, steroids or toxins, cytoxin, it's like a whole big to-do. But the hearing nerve is a cranial nerve, and that's really going to the brain. And a lot of people, it's hearing loss. So a lot of people don't realize, A, the morbidity, what it does to patients, how miserable you are when you can't hear. It defines our humanity on the one hand. The other side of it also may be representing some form of disease that's going into the brain, into the central nervous system. Concurrently, the hearing nerve is right next to the vestibular nerve, or the balance nerve. So a lot of people, if they have inflammation of the hearing nerve, can end up with what I call true vertigo. More dizziness, not dizziness. Dizziness is weakness. Vertigo is motion. And that's a very debilitating symptom also. Whenever the inner ear is diseased for any reason, including from GPA, you can get basically nerve endings that are firing off incorrectly, and you perceive that as noise or tinnitus. That's part of the reason why it happens in the inner ear. Secondary to what's going on in the middle ear. If you drain the ear early, that's usually a very good prognosis to help the hearing come back. I've even seen I've never published this, but I've seen lots of people with nerve disease in the ears get better when you put tubes in. So I'm a big proponent of tubes in GPA patients. Be aware it can affect the balance system. And just like the sinuses are contiguous or next to the central nervous system, which is a euphemism for the brain, same thing with the ear and the mastoid. So you always have to look not only where the organ is, but what can happen next door. Hearing is important for ability to communicate, hear, our sense of balance, and really to function in this world. So I take it very, very seriously.
Okay, thank you so much. There were questions about something called eardrum retraction pockets and eustachian tube dysfunction. Does that fit in with what you were just talking about?
Exactly. So if you go into when the middle ear is a little cat, so it's almost like a little tiny tube that makes fluid. Remember, our nose, the paranasal sinuses make fluid, and it drains. Our lungs made a quart of mucus every day. It drains, and it's there physiologic. Well, the same thing, this respiratory epithelium in the middle ear also makes fluid, then has to drain. The problem is, what happens if it doesn't drain? Well, ask anybody with a stone in the gallbladder when the gallbladder doesn't drain. It's not good. Ask somebody who has a bladder that doesn't drain for whatever reason, they're not very happy to get to the emergency room very, very quickly. Well, the same thing, if the middle ear doesn't drain, the hearing loss will occur relatively quickly because the eustachian tube is either not working well, the ear is inflamed, or you know what? In GPA, the nose itself can be blocked. The eustachian tube ends in the back of the nose, and if it's swollen, blocked, or has crust there, the middle ear may be fine, but the nose may not be accepting the drainage. So you'd have to look and see where the blockage is in that system. Again, like a respiratory tract. The hearing loss may be caused by a nose problem, as strange as that may sound. A retracted pocket means there's a pressure imbalance where the eardrum gets so sucked in that it's no longer really, but it's almost lining this thing called the back of the ear. And to put a tube in there is almost impossible. I always send those to the ear doctors, because that's tough to do, and usually needs a surgical solution of lifting up the eardrum and putting a tube in from behind. But you can have a retraction pocket. You can have eustachian tube dysfunction, either primary or secondary to the vasculitis.